I see here that your weight today is 70 kilograms, and so that's good. I want to take your blood pressure, so let me do that. Okay, your blood pressure's fine. It's about 124/73.
Okay.
So let me look at your hands. Just checking for swelling. Your urine tested negative for protein, sugar, and bacteria, so that's fine. Let me see the palms of your hands. Okay, and look up for me. I'm going to touch your face. Okay, that looks good. Are you having any trouble or any complaints?
No, I feel good, just maybe a little bit tired.
Okay, I have a few questions. Then I'll ask you to move to the exam table so I can do your abdominal exam, okay?
Okay.
All right, Mrs. B, I see from your chart that you've been tested for HIV and it's positive, but your syphilis test was negative. How long ago were you diagnosed with HIV?
It was last year during a community testing campaign.
Okay, are you currently taking any antiretroviral drugs or drugs to help slow down the progression of the disease?
No, not yet. They said my blood count was still okay.
Okay, well now that you're pregnant, you'll need to take these drugs, the antiretrovirals, to help prevent transmitting HIV to your baby. If you don't take them, the chances are much greater your baby will be HIV infected. So we'll test your blood count to see if your immune cells, the ones that fight infection, we'll see if they're low. If they are low, then you should start the medicine now and continue to take it always to prevent your infection from progressing to AIDS. If your cell count is okay, more than 350, then you'll just take the antiretrovirals during pregnancy and for 1 week after childbirth.
Okay, what about my baby?
The drugs your baby will take will depend on which ones you're getting. So if you're taking a drug called AZT, then your baby will need another drug called nevirapine. And they'll take it daily from birth until 1 week after you stop breastfeeding. Since you are HIV positive and we don't offer formula, we recommend you provide only breast milk for the first 6 months, then rapidly wean your baby.
Okay.
All right, Mrs. B, now you tell me what you understand about how these drugs are important.
They'll help prevent HIV being transmitted to my baby.
Yes, that's right. And we will give you the drugs, and you should start taking them at 14 weeks, which for you is in only a few weeks. Let me explain how to take them. Here are your drugs.
Okay.
At this clinic, we give you a drug called AZT, starting at 14 weeks. In labor, you'll get AZT and also nevirapine, and a drug called 3TC. You'll take AZT and 3TC for the first week postpartum. Your baby will also need to take nevirapine every day until 1 week after you're done breastfeeding, at about 6 months. It's very important that your baby take the drugs also to help make sure we can prevent HIV infection. You will start your drugs next week on Monday. You'll take AZT twice a day until the onset of labor. Upon the beginning of labor, you'll be given a single dose of nevirapine, and then you'll take AZT and 3TC twice a day through labor until 1 week after the baby's born. The drugs are critical to help prevent transmitting HIV to your baby, but they do have some side effects which we can help you manage.
Okay. How will I get the drugs for my baby and for when I'm in labor?
As you continue to come here for follow-ups, we'll make sure you have the drugs you need. We'll make sure to provide your baby's drugs too and explain how to give them. We'll give you the nevirapine during your last trimester to use during labor. You'll need to bring your baby back several times after delivery to check for HIV.
Okay, I understand.
Okay, now you tell me about your understanding of how to take these drugs.
Okay, I'll start on Monday and take AZT, this one, twice a day until I go into labor. Then I'll get another drug once, then take the AZT and the other drug, it was 3CT, twice a day. For how long?
So it's 3TC. You'll take that after labor with the AZT for 1 week after delivery. The drug you get once during labor is called nevirapine. Do you have any other questions?
No.
Okay, let me go through some of the other things we have for you for the rest of your pregnancy.